मैं रविंद्र कुमार हूँ। मैं धनबाद झारखंड से आया हूँ। मैं अपने बेटी के इलाज के लिए आया था। मेरी बेटी का किडनी का प्रॉब्लम पता चला था हमको वहाँ धनबाद में कि जो सूजन हो गया था काफ़ी सारा। वहाँ मैंने एक बच्चे के डॉक्टर से दिखाया, फिर उन्होंने कुछ बड़ा हॉस्पिटल में, वहाँ सरफी हॉस्पिटल है, वहाँ पर भेजा। वहाँ पर भी दोबारा से जाँच हुआ, अल्ट्रासाउंड हुआ, ब्लड चेक हुआ। फिर उसके बाद में पता चला कि इसका क्रिएटिनिन लेवल हाई हो गया था 11.4। उस समय फिर हमको पता नहीं चल रहा था कि हम क्या हुआ है, क्या ना समझ में आ रहा था। फिर एक मेरे परिचय का आदमी थे, वो यहीं धनबाद में तन्मय सर से उनको जान पहचान था। तन्मय मुखर्जी सर हैं, किडनी स्पेशलिस्ट हैं। तो उन्होंने बात किया और उनके थ्रू जो है तन्मय सर के थ्रू हमको सुमंत्र राउत सर का नंबर मिला और सुमंत्र राउत सर से मैंने बात किया और उनके थ्रू मैंने यहाँ नेवटिया भागीरथी न्यूटन आया और यहाँ अपने बच्चे के इलाज करवा रहा हूँ। और काफ़ी 15/1/2024 से मैं यहाँ पे आया हूँ और इस समय डायलिसिस हो रहा है और डायलिसिस चला है काफ़ी दिन से। और इस अगला नेक्स्ट प्लान है मेरा कि जो इसका ट्रांसप्लांट करवाने का, तो मैं 30/4 को मैं दिल्ली जाने का प्लान बनाया हूँ और इसको ट्रांसप्लांट के लिए लेके जाऊँगा। और बीच में काफ़ी सारा हमको एडवाइज मिला सर का, सुमंत्र राउत सर का और सोमनाथ सर का काफ़ी सारा रिस्पॉन्स रहा और बहुत अच्छा मेरे साथ बिहेव रहा उनका। और काफ़ी सारा हमको हेल्प मिला यहाँ से। नर्स सब भी बहुत सारे थे, वो सब भी बहुत अच्छा मेरे साथ रिस्पॉन्स किया। मैं भी ठीक ठाक मतलब उसके साथ बिहेव किया।
मेरा नाम प्रेरणा कुमारी है। मैं झारखंड धनबाद से आई हूँ।
तुम्हारा क्या चल रहा है? कौन सा इलाज चल रहा है?
हाँ,
क्या चल रहा है इलाज में?
डायलिसिस।
कितने दिन से चल रहा है?
3 महीना से।
और सुमंत्र सर कैसे बिहेव करते हैं, उनका क्या रिस्पॉन्स है बताओ? मतलब बहुत अच्छा है या क्या है?
बहुत अच्छे हैं।
साफ सफाई कैसा है यहाँ का?
ठीक है।
और
सोमनाथ सर कैसे हैं?
ठीक है।
तो जल्दी से ठीक होना है बेटा।
ठीक है।
नया किडनी ट्रांसप्लांट हो गया तो जल्दी से स्कूल भी भर्ती हो पाओगी और फिर आगे जाके क्या बनना है?
डॉक्टर।
Great. So today we are discussing about our magical girl Prerna. She is 9 years old. She came from Dhanbad, and actually this girl was referred to us to our adult nephrology colleagues because that child required specific pediatric nephrology based opinions and management. So this child landed up in our hospital in a very sick conditions. The child was having severe respiratory distress. There was huge puffiness. The child was swollen up. There was actually no urination was being produced that time, and her previous report was showing that she was having some kind of kidney failure. In the initial phase, the sick child, we immediately took her into a hemodialysis procedure through our critical care team, and with the good amount of critical care involvement and our dialysis pediatric specialist dialysis management, we could perform the dialysis safely, and within 2 to 3 days, her distress improved, the swelling resolved gradually, and the child gradually became well. The next point which we consider is what is the cause of her kidney failure. So on investigation thoroughly which was done in our Neotia hospital, that revealed that she was unfortunately having permanent kidney damage. So the reason was evaluated thoroughly, and once with our nephrology team, we came to know that the urine was going backwards towards the kidney, that is called also reflux, and that is the reason for her kidney failure. And regarding the management, we started having her long-term plan. We discussed and recounseled the parents, the child, our grandparents also regarding the future long-term plan regarding transplantations. And for kidney transplantation, we started initial workup for Prerna herself and also for her potential donor, her grandpa. And regarding not only for the dialysis, we took initially for at least 1 and 2 months, nearly 1.5 to 2 months to stabilize the girl and to make her initial assessment. Until then, she got nearly around 40 sessions of hemodialysis in a utmost cleanly fashion, and that's thanks to our pediatric ICU critical care nursing team and also the dialysis team, who performed these 40 dialysis in a small kid without any single day bad events or any infections. And more so, we not only for the dialysis of the medical treatment part, throughout the period we took care of her nutrition, obviously her social issues, just like she was absent for her school life or something else for last 2 months. So we tried to make some of the non-formal education, some drawing during the dialysis session, because he used to come to our dialysis unit every 3 times a week, at least for the last 1 month. So henceforth we referred the child for the higher center in the prospect of our renal transplant, and we hope that she gets a successful renal transplant very soon. And for the whole credits of this whole management, of this good management in our hospital, does not only goes to we doctors, but also goes to the responsibility to our proper clean and especially nursing, pediatric nursing care, our hemodialysis unit team, and obviously our the total whole the parents and the child. They have the faith on us to manage, to have a faith on us to have so long carried out the treatment so far. And each time, whenever we discuss and counsel the parents, they always have the provisions to ask their doubts, their queries, and we tried our level best to clear out the doubts and queries. We all hope all the best to this little kid, this little magical kid Prerna, that she gets a new kidney very soon. Thank you.
So, as Dr. Raut already discussed regarding this kid, this is a critical child and needs critical care. That is the most important from my point of view. Initial few weeks are very important. You have to manage the infection, you have to manage the blood pressure along with general care of the child. That is very important, along with dialysis. And during the dialysis, there are lots of ups and downs happens. The electrolyte imbalance and everything needs strict critical care monitoring and critical care. And our critical nursing are very important in this aspect, because to prevent infection as well as to provide proper nutrition and general care of this child. So, as a PICU point of view, this kind of kids only can be managed in proper critical care unit, along with nephrology, proper nephrology backup, and with other holistics and other supporting team is required to manage these kids properly. So, thanks to Neotia for our beautiful management of this case.